Now, probably the biggest reason why we are in this predicament is because the number one reason or the number one cause for low thyroid is not even checked for. And if it is checked for, the treatment doesn't change. It's estimated that now over 90% of you guys, you ladies who have low thyroid, actually have an underlying autoimmune condition called Hashimoto's. Hashimoto's is where the immune system slowly attacks and kills the thyroid. Now, the scary part about this is that specifically that TPO antibodies, those thyroid peroxidase antibodies that I talked about when we were going over the different markers, those antibodies that your immune system is making, it is also tagging your cerebellum. So the bottom part of your brain that tells you where you are in space, right? So it helps you with your balance, it helps you with your stability, it helps you with your coordination. The immune system is not only attacking the thyroid, but it's also attacking your cerebellum. And the only reason they're called thyroid peroxidase antibodies is because they discovered it attacking or tagging the thyroid first, right? But if they could have just as easily found it attacking the cerebellum, then maybe they would be called cerebellar antibodies or whatever. So if you have thyroid peroxidase antibodies, we have to know that it's not only attacking our thyroid, it's also attacking our brain. And so this is so important because so many of you have brain fog. So many of you are having issues with balance and coordination. And it's really important that we don't let this go uncovered because we have to slow down this process from happening. Okay. So I know that many of you are starting to get a little annoyed if this was the first time that you have heard this information, but it's interesting because in traditional medicine, they don't have a different drug for Hashimoto's or these TPO antibodies, or you can have antithyroglobulin antibodies also, right? They don't have a drug for this, so they don't check for it because it doesn't change. It doesn't change the course of their care. Now, the other thing that's really frustrating is sometimes our doctors do test this TPO antibody and it comes back negative. But I believe that it's about a 20% false negative. So I just want you to know that about 90% of you or greater, I've even seen something up to 98% of us with low thyroid actually have Hashimoto's. And it's really important to understand that we've got to handle this from a different perspective. Taking thyroid hormones is necessary, but it is not handling all of these other underlying issues and preventing other autoimmune diseases from occurring. So it's important for you to know that if you do have Hashimoto's or any other autoimmune issue or disease process, you are at higher risk for developing other autoimmune diseases. And probably half of the patients that I see, I will say, oh, you have Hashimoto's, but as we're going through their health history, they've got Sjogren's, they've got Raynaud's, they've got MS, they've got rheumatoid, they've got all these other autoimmune issues. And if I look through their health history and their family history, oh yeah, my mom had this autoimmune disease and my sister's got lupus and we've got all these other autoimmune issues. But the reason that these autoimmune issues continue to come is because you haven't balanced and stabilized the immune system or gotten down to the root cause of why you're having those symptoms.